Hello, everyone. Let's talk about carbohydrates. We hope you enjoyed today's presentation. My name is Radhika Mohan. I'm a registered dietitian with the Credit Valley Family Health Team, the Diabetes Program. Today, I'm joined by my colleague, Karina, who is also a registered dietitian, and we are both certified diabetic educators. Now let's look at the agenda for today. We will focus on the topic of carbohydrates. You will learn the effects that different foods have on your blood sugar levels. We will also discuss recommended carbohydrate intake to minimize fluctuations in blood sugars. Finally, we will give you tips on carbohydrate counting, including reading and understanding food labels, measuring tricks, and resources to make estimating your carbohydrate intake easier. This is the wellness wheel, and it is important for us to understand our approach to diabetes management, and the focus should be on a holistic approach. The specific behaviors listed on this slide, such as solving problems, coping well, being active, healthy eating, reducing risk, monitoring blood glucose, taking medications, help to manage your diabetes and keep your A1C, blood pressure, and cholesterol in target. A balanced meal is part of a healthy eating, and carb counting is a strategy to further improve our blood sugars, especially if we are seeing variations in our blood sugar post meals. This can be affected when we are on certain medications or insulin, and carb counting can help us understand if we are eating the right portions or getting the right dosing of insulin and medications. Now, what is diabetes? Let's have a brief review. It is a condition that occurs when the body cannot use glucose, a type of sugar, normally. It can be associated with various long-term complications involving damage to different organs and tissues such as heart, eyes, kidney, nerves, and blood vessels. There are things you can do to stay healthy and prevent or delay complications. Certain ways of eating can help reduce the risk of heart disease, improve blood pressure, cholesterol, and blood sugars. Having discussed what diabetes is, it is important to understand how you can manage it well. So, monitoring is a key to understanding your body and your blood sugars. Ask yourself, how can monitoring blood sugars help me stay motivated? Lifestyle has an impact on your blood sugars and can give you information to support your goals. As you can see in this image above, when you are active, your blood sugars are more stable, and when you are sedentary, your blood sugars tend to be higher and is an incentive to stay active. By monitoring your blood sugars, you can determine what strategy works best for you. Now let's look at a case. This is Sandra, a 43-year-old woman newly diagnosed with type 2 diabetes on metformin and A1C 7.5. These are Sandra's different breakfast options, and she's monitoring her blood sugars when she eats each one of them. For example, the first one is a balanced meal, which is Greek yogurt with a few berries and maybe a little bit of steel cut oats. The second option is waffles with maple syrup and strawberries. The third option is no carbohydrate at all, and it's eggs and bacon. So, what's important is focusing on healthy eating behavior is an important component of diabetes management because meal composition can affect your blood sugars. And this slide shows how different breakfast foods can change your blood sugar levels. We would also like to highlight that Sandra is using a Freestyle Libre to monitor her blood sugar levels, which is a great tool because you get this wonderful visual of the blood sugar levels and trends throughout the day. It is also a great tool to see your highs and lows and how different foods affect your blood sugars. This will help you make lifestyle decisions. For example, aiming for a well balanced breakfast, as you noticed that meal composition helps keep your blood sugar levels in target. So it is important to monitor your blood sugars more frequently, example 2 to 3 hours after meals, either with a finger poke or freestyle libre to recognize how food impacts blood sugars. From the above, it's clear that a balanced meal would result in blood sugars that are neither high nor low. As mentioned in the earlier slide, the Freestyle Libre is a tool you can use, but a regular glucose monitor can also be useful to monitor your blood sugars, as seen in the image above. Many of many of the glucometers have a mobile app that allows you to see your blood sugar trends over time that you can easily see displayed in a table or a graph. Here are some benefits and features of using your glucometer connected to apps. It helps you monitor blood sugars if you're taking mealtime insulin, and you can measure your blood sugars before and 2 to 3 hours after meals to see if the amount of carbs is well matched to the insulin that you are taking. If you're not taking mealtime insulin, you can still do the same thing and might realize that your carb amounts are not consistent and that your blood sugars greatly fluctuate as your carb amounts fluctuate throughout the day. Keeping a record of these blood sugar numbers and carbs as you are starting with carb counting will help you understand better what is happening and to better plan your meals. So let's get to understanding your nutrients, which will help you plan your meals better. Over to Karina.
To understand how food affects our blood sugars, we need a quick review of the main nutrients in food. There are three main nutrients in our food that gives us calories: carbohydrates, fats, and proteins. These three nutrients are often referred as macronutrients. Let's take a look at each of these nutrients in more depth. First, let's talk about fat. Fat is not a major contributor to sugar levels, although very fatty meals can still affect your blood sugars. Fat is also higher in calories compared to other nutrients, and so consuming too much fat can increase body weight. A small amount of fat, particularly healthy fats, are acceptable and necessary in our diet. The role of fat in our body is to give us energy and help our body grow and develop. Furthermore, fat is essential to help our body absorb certain vitamins such as vitamin A, D, E, and K. Some examples of healthy fats shown here include vegetable oils, nuts and seeds, avocados, olives, and fatty fish like salmon. Some less healthy fats include butter, lard, hard margarines, animal fat, animal skin, baked goods, deep fried foods, and fats found in processed foods. These fats should be chosen less often than the good, healthy fats. Secondly, let's talk about proteins. A healthy portion of protein does not raise your blood sugars. Remember the plate model? Although very large portions can. It's important to include healthy protein portions in all your meals, including breakfast, lunch, and dinner, as well as at snack time. Protein also contains calories, so in addition to large portions affecting your blood sugars, you also need to watch your portion size because too much protein can also lead to increased body weight. Protein is an important nutrient as it helps to build and repair body tissue. Some healthy protein foods include extra lean or lean meat, poultry, fish, eggs, tofu, nuts and seeds, low-fat dairy, and legumes such as lentils, beans, and chickpeas. A special note that these types of legumes are in both proteins and carbohydrate group. Some less healthy protein foods include high-fat meat cuts, processed meats such as bacon, sausage, or deli meats, high-fat dairy, and fried or breaded meats. Thirdly, let's talk about carbohydrates. Carbohydrates are very important for the body as they are the body's main source of energy. Just like fats and proteins, carbohydrates also contain calories. When consumed, carbohydrates turn into glucose in your blood and therefore will raise your blood sugar. Even though carbohydrates will raise your blood sugar, it's still a healthy food to include in our diet, as long as we are eating the right carbohydrates and watching our portion sizes. Carbohydrates are found in grains, starches, food containing flours, starchy vegetables, bean and lentils, fruit, yogurt, milk, and milk alternatives. They are also found in sweet foods and snacks. It is important to choose fruits, vegetables, and whole grains more often than processed foods. That includes refined foods like refined or white flours or highly processed cereals or foods that have added sugar. Now that we talked a little bit about carbohydrates, let's work through an activity to debunk some myths about carbohydrates. Only breads and grains contain carbohydrates. Myth or fact? This is a myth. Yes, bread and grains do contain carbohydrates. Other foods like fruits, root vegetables, legumes, milk, and alternatives also contain carbs and other vitamins and minerals that are important to our bodies. The next question is, fruit is part of a healthy and balanced diet, even if it contains sugar. Do you think this is a myth or a fact? This is true. Fruit is absolutely part of a healthy diet. For people with diabetes, we recommend up to 3 servings of fruits per day, spaced out throughout the day. Many patients are confused about fruit, since it contains sugar, but the sugars found in fruit are mixed in with fiber and many important vitamins, minerals, and antioxidants. When we consume whole fruit, the fiber will slow down digestion and the sugars will enter your bloodstream more slowly, compared to fruit juice as an example, which does not contain fiber, so the sugars in fruit juice would enter the bloodstream very quickly. We will talk more about fiber shortly. The next question is, all white color foods are unhealthy and should be avoided. Do you think this is a myth or a fact? Many white foods may spike your blood sugars, but it doesn't mean you can never have them. Moderation is key when it comes to healthy eating. Also, remember the best way to learn how to react is by testing your blood sugar. If you see a spike after consuming any of these foods, look at your portions and make sure that they are part of a balanced meal. For example, the starch on your plate should take up to a quarter of the plate. Also, you can look for better quality carb sources to use as alternatives by using the glycemic index chart that we have shared with you previously. For example, instead of potato, sweet potato is a better alternative as it's low in glycemic index. Another example is pasta. It can be a low glycemic index food if you cook it at al dente. The next question is, low carb diets, for example, the keto diet, are healthier, especially for people with diabetes. Do you think this is a myth or a fact? The key word in this question that makes this a myth is the word healthier. Low carb diets are not healthier than any other nutritionally balanced dietary patterns. Diabetes Canada emphasizes the importance of nutritionally balanced, calorie-reduced diets to achieve and maintain a healthier body weight. This can be achieved with several dietary patterns based on individual preferences. It's important to understand what relationship you share with food. For example, if it is a negative one, then very restrictive diets may not be the best choice for you. Research is still being done in this area, and there are no studies to understand the long term implications of these diets. However, currently, research indicates that low or very low carb diets can be considered as one eating pattern for individuals living with diabetes, for weight loss, improved glycemic control, and or to reduce the need for anti-hyperglycemic therapies. Individuals should consult with their healthcare providers to define goals and reduce the likelihood of adverse effects. There are other diets such as the DASH diet, the Portfolio diet, and the Mediterranean diet, and they are largely composed of wholesome plant foods characterized by high consumption of fruits, vegetables, whole grains, extra virgin olive oil, nuts, moderate consumption of fish and dairy, and low consumption of red meat. The plate model from Diabetes Canada is consistent with this message that 50% of your plate should be vegetables, 25% whole grains, and 25% lean meat. The diets included on this slide have shown more benefits, including more naturally sourced plant-based protein. We usually encourage patients to choose beans, lentils, soy, and chickpeas more often. The important thing is to recognize the difference between minimally processed and heavily processed plant proteins. So canned beans, chickpeas, and lentils are minimally processed and good to use if soaking beans and cooking is not feasible. Frozen edamame or plain tofu are also minimally processed plant proteins. While heavily processed plant proteins could be high in preservatives, sodium, saturated fats, and even sugar, as in baked beans, and may not have the health benefits you are looking for. Just a quick word that pulses are part of the legume family, and their plants grow in pods. The term pulse refers only to the dry edible seeds within the pod. Beans, lentils, chickpeas, and split peas are the most common types of pulses. Pulses are special because they have distinct health benefits apart from other legumes. Unlike legumes like peanuts and soy, for example, pulses are low in fat and very high in protein and fiber. As you have seen, there are many patterns to healthy eating without needing to eliminate carbohydrates, and in doing so, you're keeping other needed nutrients in your diet. But people often ask us if they should be eliminating carbs. So let's quickly review what carbs are in the next couple of slides. This could also help in our case study in a few minutes. On the left side on this slide, you see that carbohydrates get broken down into three main forms: simple sugars, starches, and fibers. Let's match them with the following statement, starting with A. Which one gives you a feeling of fullness, does not get digested, and it helps to control your blood sugars? The answer is fiber. B. Which of the followings are very small molecules, 1 to 2 molecules in length, and they can spike your blood sugars because they get digested very quickly? There are different types, and you might have seen names like glucose, sugar, maltose, sucrose, lactose. Many of the names ending in O's on food labels are simple sugars. And the answer to that statement is simple sugars. The last statement in C goes with starches. These are very large chain of sugar units linked together and get digested slower than simple sugars. Some are low in glycemic index and some are high. The last question in our myth or fact section is about the glycemic index. The glycemic index is a useful tool to help make better carbohydrate choices. Do you think this is a myth or a fact? This is a fact. We recommend that you use the glycemic index to help guide your carbohydrate food choices. The Glycemic Index Guide is a great tool that lists common foods containing carbohydrates into three glycemic index categories that are color coded using a traffic light system. Green is go. Foods in this category are low glycemic index and should be chosen most often. Yellow is caution. Foods in this category are medium glycemic index and should be chosen less often. Red is stop and think. Foods in this category are high glycemic index and should be chosen to the least often. The glycemic index is a scale out of 100 that ranks a carbohydrate containing foods by how much it raises your blood sugar levels. So you can see here that high glycemic index foods spike your blood sugars, and it is why we should choose these less often. Low glycemic index foods raise your blood sugars over time and much less, which is more manageable for your body. A low glycemic index diet can help decrease your risk of type 2 diabetes and its complications, decrease your risk of heart disease and stroke, and help keep your feeling full for longer. This slide shows the glycemic index guide for grains and starches. To better understand how the glycemic index works, let's take a look. We encourage you to think about the staples in your diet and look through this list to see if you would benefit from switching to lower glycemic alternatives. Try having a lower glycemic index starch more often than the higher or medium glycemic index starch. In this slide, we have an example of potatoes. The best type of potato are the ones listed in the green and yellow column. This slide shows the glycemic index of fruits. Some fruits may be an absolute favorite for you, but wondering if you could have them. Definitely fruits are part of a healthy diet, and with diabetes, you can have up to 3 fruits, but have them at different times. Try having the lower glycemic index fruits more often than the higher or medium glycemic index fruits. You can swap some fruits in high glycemic index with the same fruit in the medium or low glycemic index group. In this slide, we have an example of banana that you can see better choices on the green and the yellow column. To find the complete glycemic index food handout shown in this presentation, please visit the Diabetes Canada website or the list of our resources on our webpage, link in the video description. You can also get a complete list by visiting glycemicindex.com.
Let's get back to Sandra's case. Sandra has been monitoring her blood sugars regularly and gets her 3-month A1C done. Her A1C has come down to 6.5 from 7.5. As you can remember, we discussed in the beginning of the case. And Sandra followed the 1-month pattern to monitor her blood sugars and made notes. She is now aware of which foods impact her blood sugars. She is also aware of how activity helps improve her blood sugars. So we are going to review Sandra's menu and her blood sugars. This is a learning opportunity. And before we go through her meal, I'd just like you to know that we have a carbohydrate counting list on our website that you can use to understand what each portion would translate to. For example, one slice of white bread or any bread would be equal to 15 grams of carbohydrate. So it is important for you to understand how much each portion translates to so that you know how to plan your meals. So let's get to her uh, meal. So on June 1st, Sandra had cornflakes, 1.5 cups of cornflakes with a cup of milk, and so half cup of cornflakes is equal to 15 grams. So she has 45 grams of carbohydrate. 1 cup of milk is 15 grams of carbohydrate. So her total carbohydrate intake is 60 grams. and the fiber content is 0. So the goal for now is for you to look at the total amount of carbs and the quality of the carbs using the glycemic index to understand the relationship between glycemic index and her blood sugars. So as we saw, Sandra's meal plan on June 1st, it contains a lot of processed foods, and generally processed foods tend to be higher in glycemic index. Cereal with fiber are also processed but may be lower in glycemic index. It's best to test your blood sugars after having them, since most cereals are not listed in the glycemic index food guide. You could access the glycemicindex.com for more food lists. So, what happens to Sandra's blood sugars? Let's take a look. So her fasting blood sugars was 5 before her meal, but it went up to 11 after the meal. So what modifications is Sandra going to do to improve her blood sugars? So let's look at another example where Sandra replaced her cornflakes with 3/4 cup of oatmeal, which is steel cut oats, 1 tablespoon of peanut butter, a cup of milk, and 1 cup of berries. So this translates to about 45 grams of carbohydrate and 5 grams of fiber. So this meal basically has included healthy fat, protein, and higher fiber, which slows down the breakdown of sugar, and it also helps in improving satiety. So let's look at what her blood sugars look like. So her fasting blood sugars were 5, and 2 hours after the meal, it went up only slightly to 7.5. So these are just some examples, but you would always want to trial different foods and monitor 2 to 3 hours just to see the impact it has on your body. Now, there's another meal that Sandra had. She loves her white bread, and she just wants to see what happens if she had a meal that contains white bread. So she had 2 slices of white bread, 1 fried egg, 1 tablespoon of soft margarine, and 125 ml of low fat milk. So, what is the total carbohydrate content of this meal? So, this was 30 grams from the 2 slices of bread. So, overall, it was 37.5. How about the fiber content? There is no fiber content in this meal. And let's see what impact it had on her blood sugars. So, before the meal, her blood sugars was 5.7. After the meal, it went up to 11. So now again, let's see how she swaps her white bread or how she modifies her breakfast to make it healthy. So this is another example of how she modifies. So she chooses to have whole grain toast, 2 slices, the same as the white slices. She makes her egg more healthier by making it into an omelette by adding lots of vegetables to it, and the other things remain the same. So her total carbohydrate content also remains the same, but if you notice, she added more fiber to her breakfast. So how does this have an impact on her blood sugars? Let's see. So her blood sugars before the meal was 5.3, but it went up only to 7, as you can see from the modifications she made. As you can see, since Sandra monitored her blood sugars, she could see the difference in all her blood sugar readings before and after meals. So, what are the benefits of monitoring blood sugars for Sandra and for her healthcare provider? It gives us the knowledge about the effect of diet and activity on blood sugars. It confirms the presence of low or high blood sugars. It motivates you to make changes, reinforces your efforts, helps healthcare provider to provide better guidance, and fine-tune strategies to help control blood sugars. So in conclusion, monitoring blood sugars is very important. Try and use this tool to your advantage. The effects of nutrients and food on the blood sugar levels was something that we learned today. And how can you sail smoothly, avoiding the ups and downs in your blood sugars? That's also something we learned from part one. Now, in our advanced section, we will be talking about the basics of carbohydrate counting, reading and understanding food labels, measuring tricks and resources. So, we look forward to seeing you in part two, the advanced carbohydrate counting. Thank you.